Ladies and gentlemen, welcome to Interview with the Experts, proudly presented by the Malaysian Dental Students Association, MDSA. I'm your host, Ke Hui, representative from the Academic and Research Bureau of MDSA. In this series, we'll be bringing in a range of accomplished guests who will be speaking and sharing on their various areas of expertise. Today, we are very honored to have with us Dr. Abhishek Parolia, a very successful and experienced endodontist who has been working in Malaysia for almost 8 years. Good morning, Dr. Abhishek.
Good morning, Ke Hui.
On behalf of MDSA, I would like to personally thank you for accepting our invitation to be our special guest today. First of all, could you please begin by telling us more about yourself and how you ended up here as the head of Oral Health Center in IMU?
Came to IMU in 2011 and the founding dean, Prof. To Chiu Kay, who is currently the Pro Vice Chancellor of IMU, was the one who gave me the opportunity to explore myself in IMU. I still remember those days when me and Prof. To would sit down together for hours to develop the curriculum in endodontics for undergraduate students. And when you asked me about head of a department of Oral Health Center, I think I'm a work-driven guy. I like to take challenges. I like to deliver up to the expectations, and I think probably that is the reason I got the charge for Oral Health Center.
Dr. Abhishek, what prompted you to step foot into education? Has it always been part of your plan since the beginning?
No. When I joined dentistry, I wanted to be a clinician, work in my own clinic. I never thought that I'm going to be in academia. But after finishing my specialization in conservative dentistry and endodontics in Manipal University in India, I joined as an assistant professor in the Department of Conservative Dentistry and Endodontics in Manipal University. And when I joined the department gave me a very different academic environment where there was a freedom for me to develop my clinical skills, to enhance my research interest in my publication activities, and that changed my mindset completely, because then I thought dentistry is not about only the clinic. Dentistry is all about the evolution what we are going through. In fact, the research has become a very, very integral part of dentistry. Now, could you imagine, now we talk about painless dentistry, which 25 years back we could not have even imagined that. And that has been possible because of the evolution in research what we have come across. So I feel dentistry has been quite interesting for me.
So Dr. Abhishek, you specialize in endodontics and restorative dentistry. What is this specialty about and how did you decide on pursuing it?
Alright, endodontics is a branch where we deal with the heart of your tooth. The heart of the tooth is pulp tissue, which has got nerves in the blood vessels, which keeps your tooth alive and healthy. So when it gets infected, could be in the form of decay or any trauma, and the patient starts developing pain because of the infection. So we endodontists try to remove that infection and save the tooth for the patient. So this is a branch which gives you immediate rewards, because when patient comes to you with pain and you relieve their pain, they feel very happy and you feel very satisfied. Now, when it comes to endodontics, I think this is one of the few branches or specializations in dentistry where there's always something new happening, which keeps me updated, excited about the new materials, new instruments, new technology. So I feel very passionate about endodontics, and I don't think I could have done anything else except endodontics.
You have many areas of interest. One of it is in clinical audit. Could you please briefly explain what it is and how were you interested in this field?
Yes, before I talk about clinical audit, I would like to tell you about someone who introduced me to the clinical audit. And he's the Dean of IMU School of Dentistry, Professor Alan Pao. He was the one in 2012, he introduced me to clinical audit. And that's how I learned how to train people in clinical auditing. And since then, I've been training my undergraduates, and I've been training across the country how to do clinical auditing. So clinical audits actually, it is a very good tool to identify the gaps, not only in the record keeping what we do for the patients, and also the care what we provide to the patient. We identify the gaps, we take the remedial measures, we close those gaps, and we improve our oral health care what we provide to the patients. And you'll be surprised to know these students, those who have been doing the training, they have gathered a lot of data, presented the data in the national and the international conferences, and won the awards at the national and the international level. In fact, I was also privileged to get an award in a very prestigious IADR conference in 2017 in USA, where I got the Best Faculty Presentation Award, and all thanks to Prof. Alan and all the students, those who have been working with me since then.
So doctor, you have worked in India, Malaysia, and have conducted workshops in many other countries. Please enlighten us about your working experience, particularly here in Malaysia.
Yes, as I mentioned to you earlier, I came to Malaysia in 2011, and before that I was in Manipal University, India. I feel I've traveled all across the globe, and I feel traveling makes you a better person. I recommend everyone should travel, really, because it actually helps you to interact with people of different values, different regions, different backgrounds, different mindset, different skills, and that helps you to broaden your horizon, and you start developing yourself, because when you see people from all over the globe working together to achieve a common goal, it really helps you a lot. So I feel conducting workshops nationally and internationally have helped me a lot, personally as well as professionally. And Malaysia, when it comes to Malaysia, when I joined Malaysia, honestly I tell you, I didn't expect so much from Malaysia. Malaysia is a beautiful country with beautiful people around. And the best thing about Malaysians, we are ready to learn. And when I say we, I include myself as a part of Malaysians, because I'm the part of Malaysia right now.
You have been working as a dentist for over 15 years. What is the most fulfilling part of being a dentist?
Dentistry is very satisfying. When I joined dentistry, I always wanted to have a sense of work-life balance. You know, you can be very satisfied as a professional. At the same time, you can enjoy a personal life as well. You can really maintain the work-life balance in dentistry. And dentistry has evolved a lot, as I mentioned to you. It is not only the clinical field nowadays. You can be a clinician, you can be an academician, you can be a researcher, and you can be a consultant for the industry. So dentistry provides you a platform where you have got many avenues to look forward.
Last but not least, do you have any advice to give to dental students who are interested to venture into endodontics and restorative dentistry in the near future?
University is a place where students can develop professionally and personally. I personally feel I miss university days, you know, where you could explore, you could expand your skills, your learning, your friendship, your dreams, your future goals. So I personally feel if you join dentistry, not conservative dentistry or endodontics, any branch, that is going to be later. But as a beginner, university is the place where you develop a lot. And I feel that each and every student should just enjoy the journey, and they should do the best what they can do to achieve whatever goals or desires they have in their mind.
Thank you so much, Dr. Abhishek, for your time. We really appreciate it. And it was nice getting to know you more.
Thank you for having me here. Thank you so much.